For our assessments, we will be focusing on the lumbopelvic hip complex. Of course, we will be taking in other aspects of the kinetic chain points if there is dysfunction, but our main focus is going to be the lumbopelvic hip complex.
Looking at the static postural assessment, we find an anterior pelvic tilt.
In the static postural assessment, we found an anterior pelvic tilt in the client. So we're going to move forward to our transitional movements. We're going to have the client do overhead squats, 5 in the front, 5 to the side, and 5 in the back, and see if we can find any dysfunction.
Going into the overhead squat and focusing on the LPHC, we can see that the client has a slight forward lean in the lateral view. This can be because of an overactive soleus or gastrocnemius or an underactive gluteus maximus. Finishing off the overhead squats with the posterior view, we can see that there is a slight shift to the right side, characteristics of a compensation.
Now we're going to move on to the single leg squat. She's going to have her hands on her hips, foot back, and do 5 on the anterior view.
Immediately going into the single leg squat, we can notice that the client has a inward trunk rotation. This can be because of a overactive adductor complex or an underactive gluteus maximus. We're going to notice that inward trunk rotation again on the other leg as she starts, that curve inward to the right leg. After we observed the client's overhead squat, we noticed that her shoulders were not able to fully extend. They weren't exactly falling forward, but they weren't fully by the ears. So we're going to do a rotation test and the shoulder flexion test to assess that. What the client is going to do in the rotation test is they're going to stand up against the wall with their arms like this, 90 degrees. They're going to touch the back of the wall, then they're going to go down, touch the back here, up. They're going to do that 3 times. And then for the shoulder flexion test, they're going to be up against the wall again, thumbs out like this, and they're going to raise their arms, touch thumbs to the wall, and then back down. And then I'm also going to do that 3 times. And I'm going to view from the anterior and lateral. As we start the rotation test, we can notice that the hands are far from the wall and are not touching. This can be from an overactive teres minor or an underactive subscapularis. There's also a rotation of the shoulders, which will be better noticeable from the lateral view, but that can also be from an overactive pectoralis major or minor and an underactive rotator cuff. Going into the shoulder flexion test, we notice a slight elbow flex. Could be from an overactive latissimus dorsi or underactive triceps brachii. Again, we notice the same thing of the slight elbow flexion, and then we also notice a low back arch, which can be from an overactive latissimus dorsi or underactive rotator cuff. Now we are going to go do the pushing assessment. The client is going to do a shoulder press 10 times, anterior and lateral. We're looking for an arching back and falling hands and shoulders. Starting the pressing assessment, we can see that the client has a slight arch in the back, which can be from a overactive latissimus dorsi or underactive middle lower trap. From the anterior side, we can see that as the client gets farther into the reps that there is a slight elbow flex, which can be from also an overactive latissimus dorsi or underactive rotator cuff.
This is our last dynamic assessment. We do not see anything from the posterior view, but heading on to the lateral view, we can see that there is again a slight curve of the back, could be from an overactive latissimus dorsi. Next, we're going to be doing range of motion. We're going to be testing hip extension and shoulder flexion. For hip extension, if there is a decreased hip extension, we're going to be looking at an underactive gluteus maximus, and then if there is decreased shoulder flexion, we're going to be looking at an overactive latissimus dorsi. As we can see, the client has a limited range of motion for shoulder flexion, and that could be due to an overactive latissimus dorsi. For the hip extension test, hip extension was at a normal range on both sides. For the strength assessment, we'll be targeting the underactive muscle, which is the gluteus maximus. So we will be doing the manual muscle test of the gluteus maximus. For the strength assessment, we assess the gluteus maximus. The score was given as a 2 for both legs, as the client was able to resist pressure for a little bit. From our assessments, I have determined that our overactive muscle is going to be the latissimus dorsi and the underactive muscle is the gluteus maximus. For our first part of the corrective exercise continuum, it is inhibit. We're going to work on the overactive muscle, that would be the latissimus dorsi, and we are going to use self-myofascial release for that. The client is going to place the foam roller just slightly posterior and inferior to the scapula, and then the client is going to roll back and forth little by little. To increase, they would lift their arm. The next part of the corrective exercise continuum is lengthen. Again, we're going to be focusing on that overactive muscle, which is the latissimus dorsi. We're going to be doing PNF stretching for the lengthening portion. The client is going to put their arm onto a bench and pull back until they feel a stretch. They will contract the muscle for 7 seconds. After the 7 seconds, they will release and then push further to a bigger stretch and hold there for 30 seconds. The third part of the corrective exercise continuum is going to be activate. On this, we're going to focus on the underactive muscle, which is the gluteus maximus. We'll have the client be doing standing kickbacks for this. An additional activation would be positional isometrics. We are going to do something similar to the manual muscle test and just have the client isometrically hold while pressure is increased. The last and final step of the corrective exercise continuum is going to be integrate. This we're going to have the client have a yoga ball behind their back on a wall. They're going to be doing a squat, and then once they come up from that squat, they're going to do a shoulder press, and then we're going to try and make it one fluid movement. This is activating the latissimus dorsi and getting the gluteus maximus as well. This is the full table of the corrective exercise continuum, having each part, and then the targeted muscle, the method, frequency, sets, repetitions, and duration.